are definitely benign. 3, it needs further observation because of certain features. 4 is very suspicious. 5 is confirmed. This is mammographic screening. Okay, so it's very important in that situation to look at a mammography in order to determine whether further biopsy is necessary.
This is the difficulty of patients. When do they need to go for a second opinion? Okay. Do everybody need a second or a third opinion?
That is a very, very difficult question to answer. I mean, very often, a patient comes to see a doctor because he trusts. There must be a certain element of trust. Use yourself as an example. You came to see me, you saw me, I gave you an opinion, you felt that the way I presented it was logical and you were agreeable. I don't think after you saw me, you went for any second opinion. You came to me, you listened to what I had to do, you saw what I was doing for you. I mean, yours is a very classic case. You didn't go for a second opinion. And I think that we have worked well together as a team and we've been able to help you to get better.
Thank you so much, Dr. Ang. So, how about liver cyst? Liver cyst is also...
Again, liver cysts are benign, we often pick up cysts when we do simple basic ultrasound of the liver. We find it, don't do anything. It doesn't need to be aspirated. If you're concerned, just follow up over a period of time, 6 months, 1 year later, to see what is happening to the cyst. But cysts, as a general rule, I maintain are benign and do not require surgical intervention.
Even if the size is big?
Even if the size is big. I have got some patients who have got 10 centimeters cysts in the liver, but it's okay. It is still benign.
Okay. How about kidney cysts? Also benign?
Kidney cysts, again, kidney cysts are generally benign. It's very common to see kidney cysts. Some of them are very small. They could be 1 centimeter or less. Some of them can be quite big. Some patients can have cysts of 5 centimeters, 7 centimeters, and yet we do not do any necessary intervention.
Another common problem we see with ultrasound is thyroid cyst. And thyroid cancer is also very common.
Okay. Again, we separate between cysts and solid lesions. Okay. Solid lesions, you have to seriously consider doing a fine needle aspiration. Cysts, you can leave alone unless they're ugly and they're causing this bulge in the neck that you want it removed, then you just aspirate it. And often you draw colloidal material, you can send it off for testing to prove that this is a colloid cyst. And then these again do not require surgical intervention.
How about other cancers, Dr. Ang, like colorectal cancer? I heard you gave a talk before on colorectal cancer.
I actually see a whole range of cancers. I see breast cancer, lung cancer, colorectal cancer. I see ovarian cancer. I see many, many cancers. I see lymphoma. Colon cancer is a very interesting cancer. Let me share some very important facts. Okay, 85% of all colorectal cancers start from a polyp, a colon.